While you're laboring, you can utilize different positions and movements to help promote the baby descending down the birth canal for an easier delivery. So, quick anatomy lesson. This is your pelvis. This is the front. This is the back. This is that pubic symphysis, two iliums, iliac crest on the top that you can feel right here, ischial tuberosity on the bottom. We have sacrum and coccyx, so that tailbone right here. This pointy part in the back, these are your ischial spines. This is what we're using as our benchmark for the station, and that's how the baby's descending down. That kind of helps us know where the baby is in the pelvis. That's a little more reliable than just the cervix dilating. You can be further along dilated and the baby can still be kind of stuck higher. So we're going to utilize that station to know what position to use. So anything with the negative is going to be up higher in the pelvis. When we're at 0, we're nice and even with the ischial spines, and then anything plus is going to be below those ischial spines, closer to actually delivering the baby out. So if we start early delivery and we're at -3, -2, we're going to try to open up this pelvic inlet, and this is this ring right here. That's going to be anything wide knees, hip external rotation with the knees out, feet in, deep squat. If you're on the stability ball, you can also add a little bit of posterior pelvic tilt to get the sacrum to move out of the way. So we can kind of rock this way. We can do our deep squats, leaning forward, anything like that. As the baby starts to move down and we're at that 0 station, even with the ischial spines, we want to work on asymmetrical movement to help the baby continue to rotate and move down the pelvis. So we're going to rock side to side. We can lean forward, hips leaning side to side, walking sideways up the stairs. Anything asymmetrical, moving side to side is going to help us out at that point. Finally, as the baby's in the +2, +3, we're getting really close to delivery. So we want to open up this pelvic outlet. That's going to be anything internal rotation, so knees in, feet out, and then we want to get that coccyx and tailbone out of the way. So we're going to do a little anterior pelvic tilt. So we can do our knees in, feet out, kind of rocking on the ball. You can rock backwards in a hands and knees position. If you're sideline, you can have your partner help you out and hold the leg with the ankle a little higher than the knee. So all of this is going to help the baby descend a little smoother, hopefully not get stuck, and have a nice, easy, smooth delivery.